would attempt to soften that. Now, we also use a technique with that that's called laminar groove or groove technique. And in this area here, this is the rhomboid muscle group right through here. And this is an area that frequently goes into spasm, and people feel like someone took a knife and stabbed it in their back when that happens. And so I take my edge of my thumb, and again, using soft hand technique, very soft hand, relaxed hand, take the edge of my thumb and I work it right along this muscle. This muscle group here runs up and down along the spine, and the rhomboids run across here. And I'm just taking my thumb and I'm just working down in here. We call this laminar groove technique. And frequently we will find very fibrous bands, taut bands, like firm little cables running up and down the spine, and we have to take our thumb and work it into the tissue like so, just like that. Notice my supporting hand here, rolling the tissue in. This is a folding technique. Folding again, folding in there like that, rolling the tissue, relaxing it. That way, if I pull it out this way, here, if we eccentrically contract it like this, and then I work into it, then I'm working through unnecessary tension. And I don't want to do that. I want it really relaxed. I want it as comfortable as possible for the patient during the treatment. And so I utilize what we call laminar groove technique right along this area here. Now, laminar groove can be used anywhere there's a groove. And when we did it, for instance, on the elbow between the upper arm bone and the lower arm bone, which would be the humerus and, say, the head of the radius, then we call that groove technique. But that is one of the techniques that's part of our protocol of treatment.
Dr. Lawton, would you demonstrate the bony lever technique for us?
Well, the bony lever technique is a technique that we utilize to try to bring our treatment more deeply into joints and articulations of the body. We recognize that there's a limitation of our fingers and our thumb, our hands, to really be getting into some of the deep inner spaces of the joints of the body. So we have to have a strategy for that. With our first and second soft tissue layer preparation, with our deep pocket acupressure, with our periosteal massage, and laminar groove, we're really dealing with the surface areas of joints that we can address from the outside moving in. And with the bony lever technique, we're trying to exercise the joints from the inside out. And so there's these little spaces, in areas on the body and whatnot, in joints, where our hands, our fingers, what have you, are simply not going to be able to get in there and treat. We recognize that. But yet we do want to have a strategy for treating that tissue, because most likely it's also part of the person's symptoms or their pain or the inflammatory process. And so we want to be able to treat that area. And so we utilize bony lever technique, and all that it involves, all bony lever technique involves, is utilizing the bone as a lever in order to stretch the connective tissue. This would be an example here where I come up on the lateral border of the scapula in here, and I come down on the superior aspect of the, or upper aspect of the humerus, and I apply a technique like this, and I'm kind of stretching and moving that joint, which means the connective tissue that's in those deeper inner spaces in the joints is going to be stretched by my technique. So bony lever technique is a very gentle technique. It's a basic stretching technique, and it can be used on any joint in the body. We have different techniques for every single joint. And an example of technique, for instance, on the wrist bones. People that have carpal tunnel or they have arthritis in their wrist. An example of that technique is to simply come in like so on the wrist bones, or maybe these bones of the hand here, the metacarpals, come in there like this, and to stretch that like so, and to stretch it like this here, and to stretch each one of these, and then go to what are called the carpal bones of the wrist, and to make contact with the carpal bones and to stretch the carpal bones. And this gives a real nice gentle stretch, but the wrist is a really good example of this, because if you feel your own wrist, the wrist is a pretty dense and bony structure. Yet the wrist joint itself is comprised of 8 different bones that kind of slide and glide around each other that gives us our wrist movement. And yet how do you get in between them? How can a massage therapist get in there and massage in between those bones? Well, you don't want to. That would be pretty uncomfortable, actually. So what we want to be able to do is to do the bony lever technique in order to be able to open up those spaces and to move in. And again, we call it bony lever technique.
Have joint physics technique?
Joint physics technique, and technically bony lever is part of that, but we also have quite a number of other movements that we do with the joints. And with medical massage in general, we like the patient to be passive. In other words, we want the patient to just go ahead and take a nice vacation and allow us to do the work that we need to do in the area where they're having problems or difficulty. And so we always want the patient to relax this, so we will move the joints through different directions of movement and whatnot. One example would simply be torque. This is an example of torque where we just twist, kind of gently twist the joint.
Now, are you pulling and twisting, or are you just twisting at this
This
point?
maneuver here, all I'm doing is just twisting here, but we do combine the joint physics maneuvers and indeed traction. Okay, coming out like this. Traction is one of the maneuvers that we utilize. And often we will combine that with this circular movement right here.
And would this technique be good for such as frozen shoulders or?
Frozen shoulder, people get different diagnoses. Sometimes they get diagnoses of adhesive capsulitis, frozen shoulder. Common one that people used to get quite a bit, I don't hear quite as much of nowadays, is bursitis. Usually if they have a problem with a bursa in their shoulder, they have had a lot of other problems, and it's a chronic condition long before the bursa became inflamed. So usually they have some type of a tendonitis or a capsulitis condition in their shoulder. And the reason that it's important to get treatment, the reason it's important to get medical massage therapy is that if these conditions are chronically inflammatory in nature and restrict normal movement, then the area will become calcified and arthritic.